Thank you, Mr. President. I rise and I want to thank Senator Prasad for introducing this important resolution memorializing Governor Kathy Hochul to proclaim April 11th through the 17th of 2024 as Black Maternal Health Week in the state of New York. This has been an annual commemoration. This is actually the 7th year. And the theme for this year's Black Maternal Health Week is "Our bodies still belong to us, reproductive justice now." And so I'm proud that here in this chamber, we are joining the voices of many other chambers, local communities across this great state and this country to lift up this important issue. I am very proud of the work that we are doing in this chamber to pass legislation to address this public health crisis facing Black mothers in New York, because the stakes, unfortunately, are staggeringly high for Black mothers, their infants, their families, for all birthing people. In the U.S., Black women are 3 times more likely to die from a pregnancy-related cause than white women. The CDC notes that more than 80% of pregnancy-related deaths are also preventable. Black women face poorer health outcomes than their peers because of systemic issues in the healthcare system. These shortcomings include, and are not limited to, racism in the healthcare system, reduced high-quality care options for Medicaid recipients, and incentives for providers to perform more expensive procedures due to Medicaid reimbursements for vaginal births, and less invasive procedures. Major underrepresentation of people of color in the medical field. Also, systemic issues in our society, including higher levels of chronic long-term stress for Black women, compounded by the effects of poverty, lack of access in low-income and rural areas, the impact of restrictive abortion laws and denied abortion care disproportionately affect Black mamas, worsened further by structural barriers such as economic disparities and limited access to quality family planning services, and that comes from NIH, or the National Institute of Health. Mr. President, these disparities also impact Black maternal mental health. In the United States, 29 to 44% of Black women experience postpartum depressive symptoms, also known as PDS. And I want to thank my esteemed colleague, Senator Summer Brooke, our chair of mental health, who has been a strong champion on this issue as well. Yet few are properly identified and or connected to mental care services. As a state, we can and must do better for mothers, birthing people, and their infants. As the chair of the Senate's Women's Issues Committee, I am committed to fighting to ensure that New York is a safe and supportive place for mothers, infants, and their families. I am especially grateful to our Senate Majority Leader, Andrea Stewart-Cousins, for her support and leadership in making this happen, along with my colleagues. Just this year, we introduced a 12 package pieces of legislation that are designed to address maternal and reproductive health outcomes here in New York, and it was introduced on the anniversary of Roe v. Wade, lifting up the importance of doing this work and expanding access to maternal and reproductive health care. I am very proud to be voting in favor of this resolution, and I hope my colleagues will join me in celebrating Black Maternal Health Week by voting aye. Thank you, Mr. President.